WTIM Morning Show. Thank you so much to our live stream sponsors, People's Bank and Trust and Landmark of Taylorville. We are very excited to be back here in the station with another live interview. This time, I'm sitting down with Dr. Chad Anderson, the Public Health Administrator for the Christian County Health Department. How are you today, Dr. Anderson?
I'm wonderful, thank you.
Awesome. I'm super glad you're here. And what a title you have, Public Health Administrator for the Christian County Health Department. This is a new position you have just came into. How long ago did you accept this position?
Yeah, I started January 9th of this year, so still fairly new.
Getting used to it. I
Yeah.
get that. And you probably we just talked. You went to Illinois State for your undergrad, and you probably had a long story of woes here that got you to this point. 35 years of age, and you're an administrator of the public Christian County Health Department. That's really awesome. Congratulations on that. I want to know your story. How you got here.
Oh gosh, well, how much time do you got?
Not enough, never enough.
I'll kind of summary. Yes, I went to Illinois State. After that, I joined the United States Peace Corps, went abroad, did a lot in public health in sub-Saharan Africa. After my service in Peace Corps was done, I decided to go get my master's in public health from the University of Pretoria in South Africa. And then actually my research was based on malaria, and I created my own methodology for how to use music, we're on the radio, for disease prevention. And so when I presented my findings at the malaria conference in South Africa, the dean of the university was like, you gotta, get the results of this. So I got a fully funded PhD from the university after that. Got my PhD. Afterwards, I was supposed to go into Liberia to work with the Ministry of Health over there to be their malaria coordinator for the whole country. But then COVID happened and that position got taken away. So I came back to the United States, where then I got a position in Boone County. And then when this opened, I came over to Christian County. So that's kind of the easiest way to sum it all up.
Sure. Thank you for that quick summary there. And what a change of atmosphere and location there from Africa over here in Boone County. That's really awesome. So you mentioned you started at Illinois State and then took your talents to South Africa, which is really awesome. And the malaria problem in South Africa, we've also been hearing it's been kind of making its way to Illinois. There's been a couple cases in Illinois of malaria, which is a different story. But you how did you choose to go to South Africa after your undergrad in Illinois State? What drove you to do that?
Yeah, so I mean, like I said, I originally went into the United States Peace Corps, and I was in the country called Mali. So that's in West Africa, and did a lot with malaria because malaria is more prevalent in West Africa. And I just really liked public health, especially like disease control, disease prevention. After my service was done in the Peace Corps, I had been working with music actually in getting to talk about malaria because it was kind of a boring topic. And so we actually created like a rap song about malaria, and got with the ministry talking about it and working with it. And it just was like, I wanted to continue that. And actually I won an award from the United States Embassy at the time. And when I was talking to the ambassador, she was like, oh, you should go get your MPH and, not pay what we pay in the United States, pay it a lot cheaper in South Africa. So that's what I ended up doing.
Awesome. So explain to us a little bit about this your malaria findings, and with music, and how you got this information to stick with people and eventually getting your PhD.
Sure. So, the original idea came when I was in Peace Corps. So we created this rap song about malaria that would promote, what is it, symptoms, education, geared towards the youth, because at the time that was who was getting it and unfortunately passing away from it, that needed the information. So when I went into my MPH, I wanted to do that, but in a scientific way. So we created a methodology that we theorized would be able to work based on several different aspects. And then when I was offered to do my PhD, we actually tested the theory, and that was over a 2-year period of actually testing the song with different types of methodology, but we found out that it was a success, and I think I haven't spoken to my supervisor from there, but they're still using it and still working with it because of how successful it actually was. So
That's really awesome. So you found that the symptoms and ways to take care of malaria, they're hard to remember. So making a song makes it easier to remember. That's basically the gist of it. And I mean, what's the reaction to that? This different way of getting this information out there.
so we found that like in Africa, music is like part of like the culture. So it's how they story tell, it's how they, share information. So that was I think a big like kind of a ripple effect that, you drop this stone in the pond and it created the information sharing without really doing much. So there was a lot of that. So it was actually really, I got published in 3 articles for those findings. So
Really awesome. So that's a creative solution to a difficult problem there, right?
hmm
So now you are in a completely different set of problems and regulations in
Yes.
the United States. But you're looking to bring the same creative mindset to the problems here. Can you talk a little bit about that?
Yeah, so I mean, one of the things we've already done here in Christian County that was never done before is we held a food workshop. It was back in March, and we're hoping to do it annually for all the food establishments in Christian County to come to one location where they can meet their inspectors. They can hear about what's going on in Christian County. What are the kind of like major violations are we seeing in Christian County, so that they can kind of understand, talk about how to prevent it, talk about ways that like you can see our inspectors less, how does things like that. So that I think we did it for the first time this year. I didn't think it was going to have a huge turnout, but I think we had over 120 people or something come. I'd have to check, but I mean, it was a lot. So hoping to continue things like that to try to, educate community members on things and find different solutions, like I said, for different problems.
I mean, that's a valuable opportunity for these people to come in. And like you said, you don't want to see the inspector. See the inspector as little as you can.
Right.
So initiatives like that are going to keep everything just a little bit cleaner, a little bit safer. Is that one of your goals? I mean, making the communication easier, more accessible, making these things just happen.
Yeah, I think one of the goals is, I mean, there's a lot of programs within the health department that like we have grants for or we have services for that I don't think a lot of people know about. So trying to get that information out to community members in Christian County, I think is important, as well as, being able to know where we are. I don't think talking to a lot of people, they don't either know what we are, where we are, what do we do, what do we offer. So that's kind of one of the major goals is getting that information out.
Well, let's use our last little bit here for our first half here to explain a little bit about where you guys are and what do you guys do? What would you tell people if that?
So I mean, we are moving, so we're working on that transition, but we're currently at over at 902 West Springfield behind the eyeglass doctor over there. So we're kind of hidden, and that was kind of one of the bigger things that we heard, that was like, we don't know where you are, we can't find you. So we proposed and got approved through the county board to purchase the old Mental Health Association building, and so we will be moving there, TBD, as soon as we can get what we need constructed in the health department to move over to there.
And then what can people do? What do people usually have when they come in to that building? What are they doing?
Sure. Like we can do all kinds of vaccinations, or especially if your kids are going back to school, you need back to school vaccinations. We do TB reads. We've got programs for WIC and family case management. So if you need, services for you or your child to buy fruits and vegetables, you need to get milk or formula, there's programs for that. We have a grant that, unfortunately, I think there's a lot of stigma that they don't want to come in for lead testing, or we do have people who come in and test positive for lead, and then we have to fight to get them to come back. And it's just like, we have things to help you, and we have grants that can remove the lead from your house if you can allow an inspector to come in and find the lead. I mean, we have a grant that would pay to get it removed, so you wouldn't even have to to pay for any of that. So it's things like that I'm like, the health department is not a scary place. We're here to help members of the community.
Yeah, it
So
sounds like it. It's important to know because you don't know who you would call if you were to find out, and you wouldn't even know about your lead poisoning if it's in your house. You wouldn't even know unless there were great initiatives like this set up. This has been great so far. We're going to take our first quick little break here on the WTIM Morning Show. I'm sitting down with the Public Health Administrator for the Christian County Health Department. It's Dr. Chad Anderson. It's been great so far. Thank you so much to our live stream sponsors of People's Bank and Trust and Landmark of Taylorville. We'll be right back here on the WTIM Morning Show.
Your information station, WTIM. WTIM.
Welcome back into WTIM with Tim, your information station. You are listening to the WTIM Morning Show. Thank you to our live stream sponsors, People's Bank and Trust and Landmark of Taylorville. I've been sitting down with Dr. Chad Anderson, the Public Health Administrator of the Christian County Health Department. We got a little bit of his backstory, unbelievable time with the Peace Corps in Africa, and a great new way to remember the malaria virus and published and all these great things. Now, working with the Christian County Health Department, what are you looking at for the future? What are the goals? What's going on?
yeah, so one of the things that happens every 5 years that people wouldn't normally know about is health departments have to do what's called an I plan, and so that's how health departments stay certified within the state of Illinois to be a health department. And so it was actually done right before I came by Dr. Remmer, who was the interim administrator before me, who executed the I plan. And what it is like a needs assessment of what is needed in Christian County. And so what was given to me, that I plan showed that like mental health, counseling, things like that is the number one across the board from every needs assessment, from hospital, community members, anyone that's going on, or any members within the community said that it was needed. So part of the reason why I said, well, we should be able to buy the Mental Health Association building is that right now in our current health department, we're fully maxed out. There's no space to grow, no place to put like a body to have an employee. So that would have more offices. And so I've been writing grants to hopefully be, because we're all grant funded health departments. So putting in grants to hopefully get one, if not two. So I've submitted two. Fingers crossed we get one, if not both of those grants to be able to have those services come back to Christian County.
Wow. So a big focus on mental health coming down
Mhm.
the way. And that's kind of what's been found as like the most needed factor amongst these businesses.
Within, I mean, residents of
Residents,
Christian
okay.
County, yeah, the iPlan showed that mental health or mental health needs, counseling services, anything like that is uh, through the whole needs assessment it said that that's what was needed. So I'm taking that information and then writing grants specific to try to get those services back to Christian County.
How is that information found at all?
So I mean, you mean the iPlan or
The mental
the
health, like
grants or
assessing mental health and how that is like the most, the factor that most residents are lowest on.
so the iPlan, I haven't done an iPlan before, so that's what I'm saying. The administrator who was the intern was the one who executed it, but they send out what's called like a needs assessment survey to hospitals, to any like the local agencies who are dealing with things, and ask them like, what do you feel are, rank the needs that you feel are a need in Christian County that the health department could essentially assist with. And like number one across everyone, not just hospitals, but like these interagency groups, everyone came back saying that like mental health was needed in Christian County.
Wow. Is that because things like therapy and other things that would help with your mental health really aren't covered by most insurance plans? Is that kind of how that works?
I wouldn't know specifically how to answer that
Okay.
because I'm not a medical professional per se on that. So
Okay. Yeah, no, I just figured I just feel like that falls lower on the list for me, people's mental health. I mean, in terms of physical health,
Mhm.
everyone wants to feel healthy. No one wants to get sick, but I mean, no one talks about being stressed or having anxiety. So it doesn't really surprise me that much
Mhm.
about that. That's awesome. So uh, a lot of grant writing that you've been doing, trying your best to get these passed, and is that what you hope to accomplish just through your
Yeah,
grants?
we gotta start somewhere,
Yeah.
right? So, and especially is getting your foot in the door. Because I've been talking to other administrators who actually have mental health programs or divisions within their health department, and they said like if you can get one grant, I mean the dominoes will kind of fall because you can then start justifying, oh, we only have one counselor, but we have 24 clients that need it, and we have a waiting list, things like you can start justifying more of these grants to get more money into the health department to be able to hire more people or cover more services, things like that. So
Perfect. Now we have about a minute left here. Is there a website that you can plug where people can go to for information?
yeah, so cchdil.org is the health department's website. I think the county has one, and then there's a link to ours, but I'm not for sure about that. But yeah, that is our specific to the health department.
All right, perfect. I really appreciate you, Dr. Chad Anderson, for coming on today.
Thank you for having me.
Absolutely. This was Dr. Chad Anderson, the public health administrator of the Christian County Health Department. And at age 35, you are doing great things here for the Christian County. And we
Well,
were
thank
talking
you.
about that. Absolutely. And yeah, really good having you on the show today. Thanks so much for coming on. Thank you so much to our live stream sponsors as well, People's Bank and Trust of Taylorville and Landmark of Taylorville. You've been listening to the WTIM Morning Show. My name is Tim Zalabak.
WTIM.
As we wait for our SRN news to play, come down the way here, we just had a great interview, and here we go.